If you're dealing with back pain, neck pain, sciatica, headaches, or just feel like your body's not moving the way it should, you might be wondering whether a chiropractor can actually help. I'm Dr. Czekaj with Health Rehab Chiropractic. I'm going to explain what is likely going on, what we look for, and what tends to help most. A chiropractor looks at how your spine, joints, muscles, and nerves are functioning together. In plain English, we're figuring out what is not moving well, what is being overloaded, and why your body keeps getting stuck in the same pain pattern. Now let's clear one myth up right away. Chiropractic care is not just about cracking your back. A good visit should include an exam, a diagnosis, measurable goals, and a treatment plan that actually makes sense for your life. A lot of pain sticks around because the body gets trapped in a loop. Something gets irritated, then you start moving differently to avoid it. Then other muscles and joints pick up the slack, and now the whole area gets tighter, weaker, or more sensitive. So maybe your lower back starts hurting. Then sitting gets worse. Then you stop exercising. And then your body loses even more capacity. Same thing with neck pain, headaches, sciatica, or even sports injuries. Pain relief matters, of course, but if you do not also improve movement, strength, and tolerance, the same flare-up can keep coming back like an old, annoying ex. Before we treat anything, we assess. We want to know where the pain is, what brings it on, how long it's been there, what have you tried already, what your work and activity demands look like, and what you actually want to get back to doing. Then we look at how you move. That can include posture, spinal movement, strength, balance, range of motion, joint loading, and whether your symptoms look more muscular, joint-related, disc-related, or nerve-related. We also establish baselines, so progress is not based on vibes alone. And just as important, we look for red flags. If there's major trauma, fever, unexplained weight loss, new bowel or bladder changes, saddle numbness, or rapidly worsening weakness, that needs urgent medical attention, not guesswork. At Health and Rehab Chiropractic, treatment should have direction. Here is a general roadmap. Phase 1, calm things down. Reduce irritation, ease guarding, help you tolerate basic movement again. Phase 2, restore motion and control. Improve how the area moves with the right combination of hands-on care, mobility work, and movement correction. Phase 3, build strength and capacity. This is where we help your body handle real life better, whether that is work, workouts, parenting, or sitting through the day without your back staging a protest. Phase 4, return to function and prevent reoccurrence. The goal is not just feeling better for a day. The goal is moving better, functioning better, and reducing the chances of the same problem showing up again next month. Depending on what your exam shows, treatment may include spinal adjustment, joint mobilization, soft tissue therapy, rehab exercise, neuromuscular re-education, and sometimes supportive tools like spinal decompression, shockwave therapy, or electric muscle stimulation. Keyword here is supportive. These are not miracle gadgets, and they are not the whole plan. For example, decompression may be useful for select disc-related or nerve-related cases, and shockwave may be helpful with certain stubborn soft tissue problems, but patient selection matters. We use tools when they fit the problem, not just because they look fancy in the room. A common example we see is someone with a desk-based job comes in with lower back pain and intermittent leg symptoms after weeks of long sitting and less exercise. Sitting tolerance is poor, bending feels sharp, walking feels tight, and workouts have stopped. After assessment, if the issue looks mechanical and there are no red flags, early care focuses on calming irritation and improving movement tolerance. Then we progress to mobility work, corrective exercise, and gradual loading. By week 2, sitting often improves. By week 4, walking and bending feel easier. Over time, the real win is not just a lower pain score. It is getting back to work, movement, and exercise without feeling fragile. If you are dealing with back pain, neck pain, sciatica, headaches, whiplash, or sports injury, and want a clear plan instead of random advice from the internet, start with an assessment. We will tell you what appears to be going on, whether this is the right fit, and what the next steps should look like. Book your assessment with Health Rehab Chiropractic, and if you want a simple breakdown of how treatment works, download our guide below.